So I've always had passion for improving quality of services, especially for patient care. Personally, as a new trainee joining the scheme, I wasn't too sure how I could go about making changes within the NHS. And once the opportunity came along to join Improving Fundamentals, I was able to learn a lot about how I can affect change and how to ensure that we can implement sustainable change within the NHS, which was very useful for me, very helpful as a new trainee starting the scheme. I really enjoyed the course. It was quite interesting learning about the giants within quality improvement. For me personally, being able to understand how we can use different models to gather information and possible changes that need to be made has been very useful. During my placement at Leicester University Hospital last year, we noticed that we kept having an increase in our diagnostic referrals, 5% year on year. It was unsustainable. We had our capacity wasn't viable in terms of meeting our demands. In terms of patient care, it was impacting on our diagnostic rates. It was impacting on the quality of care we was able to give our patients who required diagnostic services from our departments. So it was decided that we needed to make some changes in terms of how we can reduce our referrals. And this is where I decided to use some of the things I've learned from doing this program to implement change. I decided to explore our data. So reviewing our historical data, looking at 3 years data, trying to ensure that what we've predicted in terms of increase in our demand was actually viable and was accurate. So after analysing the data, I realised it was about 6 to 7% increase year on year. And then I realised we needed to engage with our stakeholders, and the majority of our referrals coming from internally from our CMGs, and that's the clinical management groups, that's our divisions. And also we had referrals coming in externally from our GP practices. So it was crucial for us to try to, I guess, engage with our stakeholders. Firstly, we changed culture, and that was very crucial in terms of how patients being referred to our services. Most times we realised that there was a lack of understanding of what patients need to be referred for. So patients were referred for multiple diagnostic services, which wasn't necessary, but at the same time was a lack of understanding of what the patient needed in order to diagnose what the condition might have been. So changing culture was crucial internally and externally, and it was due to engagement, and it was due to trying to work in partnership with a lot of our stakeholders. There was a 5% reduction within the first 2 months. This could have been coincidental, but at the same time it was encouraging for us. This showed that our engagement with our stakeholders, internally and externally, was having an impact, and patients were being seen much more quicker. We was able to reduce our 6-week wait, and at the same time there was an improvement in terms of patient experience, which was very crucial for our organisation. The MOOC helped me to understand how crucial it is to engage with our stakeholders. You can't make change sustainable without involving your stakeholders, and it's not just about taking a punitive approach, but just being able to work in partnership, ensuring that's a collaborative effort to reduce variations within our services and within any quality improvement process you might be doing. I would certainly encourage anyone interested in quality improvements within healthcare to definitely participate in Improving Fundamentals. For me personally, joining the NHS, it was quite nerve-wracking coming into a new organisation, coming into a new environment, and for me, Improving Fundamentals gave me the right skills, the right tools required to be able to make some changes, and it's really helped me, and I believe it can help anyone regardless of your post and your position within the organisation. You know, you shouldn't have to be at the highest level for you to be able to affect change. You know, it takes just one person to be passionate and willing to make change and know exactly what to do in order to make those changes. And Improving Fundamentals gives you the right skills, the right tools, and the ability to go about to make those changes.